SADS is sometimes known as sudden adult death syndrome to distinguish it from SIDS, the sudden infant death syndrome. But in actual fact, SADS covers really from the age of 1 upwards, and sadly we do have lots of children and young people who've died from a sudden arrhythmic death.
At SADS UK we have some great running opportunities. We're involved with the London British 10K, an affiliated charity to the Bupa Great Manchester Run, the Liverpool Marathon and the 5K Big Fun runs that go on up and down the country.
On a day-to-day basis we deal with phone calls from bereaved people and those diagnosed with cardiac conditions that need very expert management to try to prevent these untimely sudden deaths. We coordinate our teams in different parts of the country and provide them with the raising awareness tools and items that they need. This is actually a role of our fundraising and awareness manager, Sarah French.
I've worked here for just over 2 years, supporting members as they raise awareness and funds for the charity. I'm always encouraged by people's enthusiasm and their generosity.
We organise annual retreats for people who've been bereaved and also patient support breaks for people living with conditions. We organise conferences and awards dinners. We hold the annual National Lifesaver Defibrillator Awards in London, and this is to honour people who've used defibrillators and actually saved a life. So this is a very important awards event that we hold. We also hold the annual National Community Defibrillator Awards, and this is for people who've gone out of their way to help the charity and provide defibrillators in their own communities.
I got involved with the charity originally through my uncle who suffered a cardiac arrest in 2006. Unfortunately he was swimming at the time, but luckily did get pulled up the walls, everything was great, taken to the hospital. After about 6 weeks he recovered, and now he's had so much to do with the charity. He really enjoys being part of it.
At SADS UK we have school defibrillator packs which contains lots of information about defibrillators and frequently asked questions, and I work with schools and liaise with them.
We liaise with schools and organising defibrillators for schools and other organisations. We also donate heart monitors to rapid access clinics and medical centres, and we keep very strict databases and records of the progress of all the cardiac equipment we're putting in place.
The Defibrillator in Schools campaign is something that I do get involved with, and having 2 young children myself at primary school, I think it's a very valuable thing to have a defibrillator on school premises.
We think it's important, once we've donated a piece of equipment, that the community know they have a defibrillator at a particular school and in their area. We also speak with cardiologists and doctors to help our patients who've been affected by SADS or are living with an inherited cardiac condition. We work very much with the ambulance services throughout the country, who are keen also to see the defibrillators in place in more public places and in schools and sports centres, because they know that early defibrillation saves lives. Having them actually on the premises means that somebody can use it very, very quickly, and whilst they're on their way to the scene, they know that life-saving actions being taken.
Before working for the charity I didn't know a lot about it. I wasn't really aware of what the hard work that everybody does here, all the fundraising that goes on. I wasn't really aware. Obviously my uncle had a cardiac arrest, but I was a lot younger when he had it, so I didn't really know much about it at all. But since working here I've understood how important it is and how frequent it is that people are suffering cardiac arrests, and how important the charity is to helping schools out with getting defibrillators in place.
They have the potential to save lives, and we know they will save lives. And for the cost of a computer, £1,500, we believe they should be on site.
We went along to the Olympic Stadium on the 1st of April, which is really good. We had a few fundraisers and representatives along with us, and they all wore SADS UK t-shirts, which was a really good day. And we also had some people parading the stadium, which they were the first people to be on the stadium. One
of the most important things that we're doing at the moment is the SADS UK Big Shock campaign. We originally ran this in 2007, and we had an early day motion to put defibrillators into schools and had a lot of parliamentary backing. But obviously there's been a change of government and NHS systems. So we've now launched the Big Shock campaign in 2011, and this is to try to get defibrillators made mandatory in schools. We've had an awful lot of support from the public, and this is moving forward with great momentum at the moment.
We really couldn't do it without our brilliant fundraisers, so thank you to everybody. If you'd like to fundraise for us but are not sure how, get in contact and we can send you some fundraising ideas.